Hello, and welcome to Why Do We Do That? A psychology podcast that deconstructs human behavior from the perspectives of social scientists, psychologists, and others that use applied psychology in their work. I'm your host, Dr. Ryan Moyer. In this episode, I sat down with Dr. Rebecca Eudy to discuss sex in long-term relationships. Rebecca is a clinical sexologist and licensed mental health counselor specializing in relationships, intimacy, and sexual well-being. She uses a variety of evidence-based approaches, such as emotionally focused couples therapy, to help individuals and couples strengthen connection, improve communication, and navigate the challenges that arise throughout the lifespan of relationships. Rebecca co-hosts a podcast focused on sexual health and intimacy called Under the Hood, and is the author of Parents in Love, a guide to great sex after kids, which was the focus of our conversation. One of the most important takeaways from my conversation with Rebecca was that changes in sexual desire are a normal part of the transition from early romance to long-term commitment, even among deeply connected couples. As novelty fades and life becomes more complex, fluctuations in desire should not automatically be interpreted as a sign that something is wrong with either partner or the relationship. Instead of spiraling into assumptions or silently searching for explanations, the healthier response is often to move toward vulnerability. Openly sharing fears, frustrations, and desires creates the opportunity for genuine understanding. Another insight that stood out was Rebecca's nuanced perspective on differences in sexual desire. We must be cautious about assuming our partner experiences desire in the same way we do. In many relationships, one partner takes on the role of the pursuer while the other becomes the withdrawer. Pursuers may benefit from reducing pressure and focusing on fostering connection, emotional safety, and responsiveness. Withdrawers, in turn, may need to become more intentional about managing stress, communicating their needs, and creating space for intimacy. Ultimately, the more rigid our expectations become about how desire should look, the more difficult it becomes to find a mutually satisfying path forward. Healthy relationships are not built on perfectly matched levels of desire, but on flexibility, understanding, and a willingness to work together to create a fulfilling connection. If you feel that something is off in your sex life, whether it's declining desire, the demands of daily life, or simply the passage of time, this episode offers practical guidance for having the conversations that can help you and your partner build a stronger, healthier, and more satisfying intimate relationship. Enjoy. Okay, today I am joined by Rebecca Eudy. Thank you so much for being on the show today.
Yeah, thanks so much for having me.
Rebecca has a book out called Parents in Love, a guide to great sex after kids. So we're going to be talking about sex in long-term relationships today. And I'm sure that most of what we talk about will be helpful whether you have kids or not.
Mm-hmm.
But obviously, there are some unique challenges to couples that are navigating children into their relationship. I wanted to start off by with the disclaimer that we're probably going to be making a lot of generalizations today, right? The goal is to talk about patterns of behavior that you see in couples. I have some thoughts as well. And anytime you talk about men and women or relationships, we have this tendency to say, well, there you might be the exception. And I think it's just best to say, like, if you're listening and you're like, that's not me, that's okay, because we're going to be talking in generalizations at many points throughout our discussion today.
Mm-hmm.
Why don't we start by having you give an overview of how relationships evolve? Because I think as couples as couples develop their relationship, they get married, they have children. I suspect that as they notice change happening, especially if that change is negative, they most likely start getting in their heads a little bit. They most likely start to think like, is this abnormal? Is my relationship falling apart? And it seems to me after reading your book that a lot of what they experience is actually pretty normal. So could you give us an overview of some of the normal expected changes that someone might expect as it relates to attraction and desire as a relationship grows?
Yeah, absolutely. So the book, you're absolutely right. It's about maintaining sex and intimacy in a long-term relationship. And really the core of the book, whether you have kids or not, is desire difference. And so, what research tells us about a difference in desire is that a couple who does not have a difference in desire, someone who's completely matched in their
Hmm.
relationship for the entire length of their relationship, basically does not exist.
Right.
So, at some point, for some reason, there's going to be a difference in desire. And for some couples, through the lifetime of their relationship, there's one person who's consistently higher desire than the other. And for some people, it can switch. Certainly when we're talking about having kids during pregnancy, during childbirth, during the, period of time after you have kids where you're not sleeping, it's perfectly normal for either one, either the birthing partner or the non-birthing partner, to be either higher or lower desire. And then we also have a lot of times another big sort of sea change in desire where we can see things get a little wonky is around menopause and perimenopause and midlife. And so sometimes for men in particular, this can be a dip in testosterone. It can be sort of dealing with some erectile or performance issues that they've never dealt with before that can really affect their desire. So that's normal. So a difference in desire, I've never met a couple that doesn't have a difference in desire at some point. But what the book is about and what a lot of my work is about is how to communicate through a difference in desire, how you manage a difference in desire. And one of the things you said that couples often get in their heads, that's exactly right. They start to think, oh, this isn't normal. Oh, this isn't good. Oh, this is bad for the relationship. And so, we get a little panicky. And when we get a little panicky, then we start to assign a lot more meaning. We take things personally.
Right.
We are less able to listen. We are more reactive. And so those things, more than the actual difference in desire, is what causes the distress in the relationship.
Hmm. So, from what I'm hearing, the one thing that you want to avoid is a panic type reaction where the sky is falling, and then which can obviously exacerbate your negative mood because now right now your thoughts are supporting all of this stuff that you're observing, right?
Yeah.
So how do expectations play into this? Because it strikes me that if you are if you're kind of playing center fielder and you're kind of fluid as you progress in your relationship, you're flexible in terms of your expectations. It seems like a lot of this can be avoided. That people tend to go wrong when they set their expectations based on what the early part of the relationship looks like, and
Mhm.
they don't leave room for any evolution. Do you think that is the case?
Yeah, I mean, desire works differently in the beginning of relationships because novelty is a big factor in the beginning of a relationship, and novelty is definitely an aphrodisiac for most people. So that is one big aspect, and then the other big aspect in the beginning of a relationship that does change in a committed relationship is actually anxiety. So a lot of times in the beginning of a relationship, one of the main reasons why people want to have sex, other than it feels good and it's a connecting experience, is that it's reassuring. And so in the beginning of a relationship, when you're in that phase of will we, won't we, are they going to call me? How much do they like me? Do they love me? Do I love them? We often are having sex for relational reasons. And one of the things that I hear a lot about from couples is that they look back in the beginning part of their relationship as sort of the heyday where they were, sort of having sex all the time and it was so great and their desire was, so much higher. But they don't often talk about that sex is like the best sex of their relationship, the most pleasurable sex of their relationship. Oftentimes, couples will start to have very consistently pleasurable sex as they get to know each other, as they get to know each other's bodies better, but they may not have the same urgency that they have in the beginning. And that's because, we'll go into this, but I'm sure we'll go into this, but the difference between spontaneous and responsive desire is that, in the beginning of the relationship, that urgency, I have to have you right now, that's spontaneous. That's more spontaneous. And as we get further into a relationship, it's much more likely and much more common that there's more responsive desire, which starts with willingness, not a internal sense of, I must have you right now.
Mm-hmm. So for the listeners, like this dynamic between spontaneous versus responsive, right? So the men are generally speaking the spontaneous desire parts of the couple, although there are exceptions, in the sense that that randomly throughout the day the libido could kick in and someone might want to engage in sexual behavior. Versus that responsive side is more, it's literally responding to the efforts or behavior of the other partner. So they might have low desire, but then if the other partner tries to initiate or something like that, their desire then goes up in response, right? That's what you were saying? So talk a little bit more about this psychology of desire and how it can it can create complications when it comes to engaging in initiating sexual behavior.
Yeah, absolutely. Yeah, so spontaneous desire, if you think of that, it's sort of like a light switch. Or Emily Nagoski talks about it as like a lightning bolt. So you're walking down the street and then all of a sudden it's like, bam, let's go. And so, yes, this is often, men may experience more of this because they have more testosterone. So testosterone is a big driver of desire and particularly spontaneous desire. But I work with many men who do not have a lot of spontaneous desire. And those men often will feel like there's something wrong with them. There's not. It doesn't even necessarily mean that those men have, low testosterone or that there's something, hormonally going on. They may just not have that much spontaneous desire. Responsive desire, if you think of it more as like a campfire, right? You have to gather the wood. You have to it's got to be dry wood. It's, I don't want to belabor the metaphor too much, but it's more of a slow burn than a quick switch. And so one of the things that's really important to understand about these two different types of desire is that with the spontaneous desire is wanting something that you don't have. Arousal is different than desire. Arousal is physical response. So it's increased lubrication. It's erection. It's the physical response of being turned on, of being aroused. And so with spontaneous desire, what often happens is that the desire comes very quickly with the arousal. So the arousal may come more, before or after, but they often are like almost simultaneous. Whereas with responsive desire, it starts with willingness. So willingness to engage in a sexual interaction. So that might be, I know this is going to be good for my relationship. I know that once we start doing it, it's going to be really pleasurable. It might be, this is something that my partner wants, and I am consenting and willing to do this with my partner because it's what they want. So we can have willingness for any number of different reasons, even willingness of, I know that afterwards it's going to feel great. We're going to feel closer. I'm going to feel less stressed, And so you have the willingness, which feels much less satisfying to the partner and even to the person who's experiencing it than that sort of vavoom, I've got to have you right now. So we're not conditioned to think of this as like real desire. So what ends up happening with the responsive desire cycle is that you have the willingness. So you enter into the sexual, you don't feel desire yet, and you also are not feeling arousal. So then you start, fooling around. Maybe you're kissing, maybe you're touching, and then arousal starts to kick in. And it's only after arousal starts to happen that then feeling desire. Then desire happens, more arousal, and then eventually resolution and, sort of completing the sexual cycle.
Yeah, I found this. Yeah, and I find this to be incredibly helpful because typically, you go through life, you develop short-term relationships, long-term relationships, and you often just decide that everyone else's experience is pretty close to my own. And in a heterosexual relationship, this can be disastrous. Like it's just, and I see it from, it's so important to manage your expectations and to take yourself out of your expectations and ask yourself, how is this person sitting across from me different from me? Because, to a male with that kind of quick, spontaneous, both typically arousal and desire, it can be, confusing when a woman changes her mind after you start making out or something like that. It doesn't even register unless you understand that kind of unless you understand the differences in arousal. And the same thing goes for women. That I think that women, it's so important for them to communicate clearly to, especially, early on in partnerships, like to communicate that, my level of arousal is very different and it takes time. But the reality is that oftentimes we don't have this kind of language. We don't have the language, especially when we're younger. We don't have that language. But I mean, you wrote this book for married couples, and I'm sure there are tons, the vast majority of married couples may not even have this language to talk about their desire.
That's definitely true. Yeah, it's absolutely true. I think you're right. It is really important to have the language to be able to have that understanding. I think a lot of times one of the things that couples also get wrong is that they look back on their, early relationship and they see all of this spontaneous desire. They say, well, you used to have a higher desire, or we used to have sex a lot more than we do now. They look back and they say, well, they used to have the spontaneous desire. Why is it hard now? Why does it feel like so difficult? And I think that one of the things that we really get wrong is that we miscode spontaneous desire for actually responsive desire. So even in the beginning of relationships, we have to think about how much time did we spend planning a date? How much time did we spend getting really curious about our partner? How much time did you spend picking out an outfit or getting ready or anticipating it? How much time did you spend saying, I can't wait to see you on Friday. I've been thinking about you all week long. So all of that is actually kindling the responsive desire. So then by the time you get into a sexual situation, foreplay has been happening for hours or days or weeks sometimes. And so when we're in a long-term relationship, when we are not only lovers and partners, but also parents and roommates and co-CEOs of a household, we often expect ourselves to be able to go from putting the kids to bed or doing laundry straight into a sexual situation without really connecting with ourselves, with our partners, without doing the things that used to make us feel attractive and sexy. And so even, and so for people who have more spontaneous desire, where there's that outside driver, where arousal and desire show up really closely together, they may have an easier time making that switch. Their runway is a little bit shorter, but we have to think about all of those things that could be foreplay, even though they're not in the bedroom and they're not sexual, that we might have been doing before that helped our more responsive desire partners to really get into the place where they could actually be sexual when there was the opportunity to do that.
It's interesting that you mentioned that in early on in a relationship, the buildup is built in. That's another thing that I think most people take for granted, because I think men that feel like they're married men who feel like their wives' desire declines into the marriage, I don't think they adequately consider that early on, and that separation that built up the desire, the right early on, there's more texting, there's more flirting and all that stuff. And I think it seems as though men just take it for granted. They see it as one continuous line, and in reality, when you get married and you move in, you're spending more time together. That a lot of these changes are very natural, and they have upside. Cohabiting, it's all great. You get closer with your partner, you get in a routine, your love builds. But I never really thought about the idea that, in addition to novelty, because you mentioned novelty, but
Yeah,
you
that's the thing,
you
for sure.
you also mentioned that foreplay was built in. I found that, yeah, that was very interesting.
And I would say, Ryan, as well, I know that we're sort of speaking generally between, saying men and women, and we're making the assumption that men have more spontaneous desire and that they would be the higher desire partner in the relationship. And statistically speaking, it is true that men do tend to have higher desire than women. So this has been long-term studies. This is a thing, but it's not as much as you'd think. And with the couples that I work with, actually what I find is that, it may be that it's more common for men to be the higher desire partner, but really it's not 50-50, but it's pretty close to being that. And I think that one of the things that that's really important is that there's a lot of validation for the high desire guy who is like, oh man, my wife is, not interested at all. And the woman who's like, my husband is chasing me around the house and like, I just cannot get rid of him. So there's a lot out there that those people feel pretty validated if they're in that sort of stereotypical relationship. For those people, maybe, I mean, I'm going to completely make up this statistic, but maybe like based on my work, like 30 to 40% of couples who might be in the relationship where the woman in a heterosexual relationship is the higher desire partner, they end up feeling like there is something wrong with me.
Yeah.
And their male partner feels like there's something wrong with them. And they are often silent. They're in a room of their friends, and their friends start talking about, oh man, my wife, she doesn't have any desire. And the women start talking about, oh man, my husband won't leave me alone. And those people who are not in line with the cultural norms are not saying anything. They're just silent because there's a lot of shame there too. So I think that it's really important to recognize that this, even within the course of a relationship, can very commonly go both ways there.
Yeah. So in the book, you couch these categories, rather than obviously the male versus female. You couch these categories as the pursuer and the withdrawer,
Yes.
and also this dynamic is not just about desire. It's not just about sex, but you talk a lot about disconnection and the cycle of disconnection. And you suggest that a lot of these issues, where on the surface it's about sexual desire and in the bedroom activities, that in reality it seems as though it's something that's coming before that, which is the
Mhm.
disconnection in the relationship. Could you talk about disconnection and how that relates to issues that couples may be thinking are isolated or contained to the sexual issues that they're having?
Yeah, definitely. Yeah, so I really like to frame this more as the pursuer and withdrawer, because even saying high and low desire partner, they're completely relative terms. So you could have a couple who has sex, 3 times a year, and they are both thrilled about it, and it's
Mm.
working great for them. They both have relatively low desire.
Hmm.
Or you could have a couple who's having sex every day, and they're both also thrilled about it. So if their desire is matched, then there's no one who's high or low, if that makes sense. So to
Interesting.
say high desire partner, it's like they're only a high desire partner compared to their low desire. And so I think this is particularly detrimental for the low desire partner. If we say you have low desire, I mean, they may or may not identify with that, but oftentimes for the low desire person, there's a feeling of being broken or having something wrong with them, of letting their partner down, and that is not sexy. So that cycle of feeling like they're
Mm.
not living up to it, or they're not able to sort of match their partner's level of desire, actually compounds the problem of the high desire. So just like framing it a little bit more as one person, and oftentimes what ends up happening is that in this cycle of connection or disconnection, you have one person who's more of the pursuer and one person who's more of the withdrawer. And so it's really common that you could have a relationship where one person was the emotional pursuer. They might be bringing up things that bothered them, things that somebody said or somebody did that made them feel bad, wanting to get their emotional needs met and in search of that. So they would be the emotional pursuer. Their emotionally withdrawing partner might rely a lot more on compartmentalization. They might be avoiding conflict outside of the bedroom. And then in the bedroom, it's totally normal for those cycles to be aligned. So you could have a emotional pursuer who's also a sexual pursuer, or you could have an emotional pursuer who's a sexual withdrawer. And this is sort of like the stereotypical like man woman divide, which, I think there's some truth to that, but also I've seen it every which way, where there's the sort of withdrawing man who doesn't want to talk about his feelings, and the woman who's kind of nagging him and asking him, if you listened to me, if I felt more connected to you emotionally, I'd be more open to having sex. And
Hmm.
then in this stereotypical sort of scenario, the guy is like, well, if we had sex more, I'd be more open to talking about my feelings. um and
Classic,
so
right? Very
classic,
classic.
exactly.
Yeah.
Exactly. And I see this all the time. It's classic for a reason. Like it is not untrue, but the thing is that both are right. Both are right, because you can emotional intimacy, being open about your feelings, having a safe place to go, having somebody who, you're really able to be vulnerable with. That is deeply connecting. It makes us feel less alone. It is something that makes us feel safe and secure and truly loved. And also, sexual connection is a great way to feel that as well. But what can often happen, and this is something that is sort of socialized along male female roles, is that men are not often taught, boys and men are not often taught or encouraged to talk about their feelings a whole lot. They're encouraged to compartmentalize, to be more stoic. Not, they don't have the coaching that girls have about, being emotionally aware. And so oftentimes a lot of that need for connection and intimacy gets channeled into sex, because that's a place that they feel like they're actually able to get that connection. And so it's not uncommon that I might work with a heterosexual couple where that sexual pursuer is talking about sex as a need. Like it is like they feel like they need sex as much as they need air or water. It's like really almost impossible to live without.
So the picture you're painting here, it feels like when you look at the two individuals in a couple and they're struggling with this pursuit and withdrawal cycle, that some of this relates to security, in the sense that, like you said, if you view sex as a need, like, well, it's not really a need like food or water, but it would make sense how you would perceive it as a need if if your sense of self was just, a little fractured, and you need, you say that you need this constant reassurance. And again, it could go both ways. You might have this strong need or craving for emotional security or physical security. Does this mean that individuals need to work on themselves independent of their partner in order to repair the connection, or is this something that couples can resolve together just through conversations?
Yeah, both and. So
Okay.
it's really easy for us to point out. I mean, I think probably you, me, and all of your listeners, if you took a poll and they said, well, what could your partner be doing better to make you feel more supported? We could all list, all the things. It's easy to look at the person that you're with and be really clear about what they need to be doing differently. But it isn't until we are able to look at ourselves and recognize, why is it such a need for me? Why do I, have this particular strategy that is not helpful, that we can start to change. So, and also in this framework, excuse me, the framework of the book and the way that I work with couples is a couples therapy method called emotionally focused therapy. And it's highly research-based, and it's the framework is based in attachment theory. And so what the framework says is that in childhood, we all, in an ideal situation, we would have a secure attachment with our caregivers. But that's not always the case. And even secure attachment doesn't mean that you're going to automatically have a secure attachment with your partner, with your chosen partner. And so we have the opportunity, it's like a second chance at this secure attachment. And if you have attachment wounds from childhood, which almost everybody does, even people who had wonderful parents, a wonderful childhood, there's going to be some attachment wounds that come up. And so we have the chance in our intimate chosen relationships to get that secure connection with our partner, where we really feel like they're there for us, where we feel known and we allow ourselves to be known, and we accept the person that we're with for who they are. And then we're able to connect to make that secure connection with them. But it doesn't just happen naturally. It does take quite a bit of work. And sometimes that is definitely going to include both individual and couples work, whether it happens in therapy or not. It's based on sort of those strong communication skills and the ability to see your partner as someone who is different than you and who's separate from you, and not take their feelings and their experience personally, because most of the time it's not.
Where do couples typically go wrong in their initial attempts to resolve a desire discrepancy?
So initially they go wrong by not communicating enough about it. So you asked about expectations earlier. And so especially for heterosexual couples, it's interesting, when I was doing the research for this book, most of the research that's out there is done with heterosexual couples. And actually a lot of the research is done with women. It's like this question of like, what do women want? It's like the perennial question. So there's a lot of research on straight women And there's a lot of research on heterosexual couples around desire difference. But what research there is on gay and lesbian couples, queer couples, suggests that they do not struggle as much with the not with the desire difference. The desire difference is still there, but they don't struggle as much with the emotional consequences of a desire difference.
Hmm.
And I don't know that there's enough research that tells us why this is. It just points to that this may be the case. There's definitely the need for more research here. But based on my own clinical work, what I have found is that gay and lesbian couples tend to talk a lot more about sex. They tend to have a lot more consent conversations. They tend to be a lot more open to different configurations of the relationship. They tend to also be more realistic, maybe, about navigating sex as something that's not, it's not assumed what sex is. And so they tend to communicate better about it. And then when they communicate better about it, there is less misunderstanding and hurt. And so a lot of times for heterosexual couples, one of the first places that they go wrong is that there's an assumption that they owe each other sex. You get married, you're in a monogamous relationship. There's an expectation that we're going to be having sex on whatever the regular basis number that's in your mind that's reasonable. And a lot of times people don't talk about this. They don't talk about what it means to be monogamous. They don't talk about what it means to have a satisfying sex life. A lot of times I work with couples who are so uncomfortable talking about sex at all. And the couples who have really good sex long-term, who are able to maintain a satisfying sex life long-term, talk about sex way more than they have sex.
Interesting. Interesting. Yeah, I don't know if you know this, Rebecca, but men are from Mars and women are from Venus.
I've
So
heard. Ryan, I did hear that.
perhaps the reason why the homosexual couples are better communicators is because they share more of their patterns of thinking.
Could be.
Just a thought, but it definitely it definitely makes sense that the communication piece. It's as I've gotten older, I find it absolutely shocking that that adults find these topics that that you're supposed to be able to talk about that with your partner. There shouldn't be there should be very, very few closed doors when you're in these long-term relationships. Why do you think it's or what do you think the key hangups are for couples who they just can't have the conversations?
Well, I think first of all, in long-term relationships, it actually can be harder to talk about these issues because we have an expectation that that we should be sexually compatible with the person that we choose. And if we're not sexually compatible, then maybe it means something about our relationship. Maybe something's really wrong. And so sometimes people choose their long-term partners for reasons, you may have a sexual partner who was just like really dynamite, but would have made a terrible long-term partner. So you may not have chosen them as a long-term partner. It may be if you have a long-term partner who's also very sexually compatible, a lot of times one of the things that makes them sexually compatible is that you're able to talk about things. But when things don't go well, when you have experiences where you have a misattunement or you ask for something or you want something and it doesn't quite go the way that you thought it would, those experiences especially with someone that you really care about. If you don't really care about the person, imagine like a one-night stand, you can ask for whatever you want. You could say really whatever you want if you're not invested in the relationship. But if this is a deep, meaningful relationship that you're invested in, the last thing that you want to do is make your partner feel bad or make them think that think something bad about you. And then layered on top of that, I think that very few people come from families of origin that talked openly about sex. And we also in our culture have a very weird relationship with sex. It's sort of like in this, mainstream culture, it's, there's just a lot of mixed messages. And so while we have sort of a fascination with sex, we also have a real taboo around it as well. And so it can feel really, really challenging to talk about.
Yeah. So as I was going through the book in my head, I was kind of drawing lines between outside the bedroom solutions and inside the bedroom solutions,
Mhm.
in the sense of, in terms of all of the discussion on connection, that you kind of want to work on the connection first, and then if you're having very specific issues during intercourse, we can deal with those separately. So let's just dive right in and talk solutions. What should couples focus on when they're experiencing disconnection? What should couples focus on to reconnect for the purposes of enhancing or rekindling their sex life?
So I think that the line that you're drawing in your mind, I understand why you're doing it, and it makes a lot of sense, but it rarely is that clear cut. So there are some couples who come in and they're like, you know what, our sex life is great. And it's really just the emotional connection that we want to work on. And then there's some couples who come in and they're very emotionally connected, but their sex life is really an area where they want to focus. But more often than not, I have couples who are struggling both with their emotional connection and with their sexual connection. So these tend to be very intertwined. And when we work on, when you start to work on the sexual connection, a lot of times it requires the same skills that you would have to enhance your emotional connection. And vice versa, although I will say that one of the mistakes that a lot of therapists makes is that if they just focus on the emotional connection, then the sexual connection is just going to like sort of rekindle. Sometimes that happens, but I do find that you have to pay particular attention to the sexual connection because people tend to have such taboos about talking about sex that when they learn to talk about other things more openly, it doesn't necessarily translate to the sexual connection. So, with that said, I would say that in terms of solutions, one of the first things that we do is make sure that we have to get out of obligation. So a lot of times when there's a difference in desire, couples come in and they're doing a lot of obligation sex. So it's like, they're having sex once or, once a month or whatever it is, but it's obligatory. It's like the higher desire partner, the sexual pursuer, has gotten so fed up that their lower desire or their sexually withdrawing partner is like, okay, fine, let's just have sex. And that is like a very deeply unsatisfying cycle for both people. A lot of times the sexual withdrawer will think, well, all right, you got what you wanted. And so now it sort of resets the clock. But actually, it's been my experience that for the sexual pursuer, that's also deeply unsatisfying as well, because a lot of times what that pursuer wants is to be wanted.
Right.
To feel like they have really a partner in the process. So the first thing that we do, and a lot of times when couples are in this like obligatory sex cycle, is I will actually tell them, you're not allowed to have sex. Like that, we sort of take that off the table. And then the next thing that we do, and a lot of times this is a little bit, I got to get a lot of buy-in about, especially for the sexual pursuer, we have to get buy-in. A lot of times the sexual withdrawer may actually start to feel more desire when it's less pressure, because pressure kills desire. So we take the pressure off. That's the first thing that we do. And then the other really important thing is that we really need to expand the definition of what sex is. So with the couples that I'm working with, I tell them that even just talking about sex is sex. Talking about scheduling sex is sex. Talking about what you liked, talking about, fantasies, desires, but even just the nitty-gritty of I really want to get into a place where I can even think about having sex, that I could even think about having desire, but I don't know. I'm feeling so stuck. That's also talking about sex. So we like blow it wide open. And then, thinking about what couples typically sort of do together, also like really expanding that, because a lot of times the person who has less desire, the sexually withdrawing partner, will withdraw entirely from any sort of physical contact. So a kiss or a hug, or that the any contact ends because they're afraid that their pursuing partner is going to see that as sort of the green light,
Right.
and then they disappoint them and they let them down again, and it's the worst. So that bringing back in some of that touch and some of that ability to be like, okay, so you could make out for 10 minutes and then that's what you do together, that's actually what that person has desire for. So starting to wake up that desire by getting really creative about what desire could be.
Mm-hmm. Yeah. You talked about this as kind of redefining what sex is. And, as somebody who, personally, I, if I would have read this, 10 years ago, I probably would have pushed back and said, that's nice and all, but that's not very satisfying. I think in reality, like
Satisfying
having,
for who, Ryan?
well, well, right. For me,
Yeah,
but
okay.
I think now, like, current version of myself, I think I think that those softer examples of sexual activity, like you said, talking about it, talking about your desire, you talk a little bit about some exploring each other's bodies, those types of techniques. A complete and utter buy-in, current version of myself. So you have to. I think men who are, skeptical of the no sex solution really need to kind of step back and lean into this redefining sex piece.
Yeah. And I want to be clear too, the no sex solution is not the end of the solution. That's the beginning. Because what pressure does, the pressure to have sex, the obligation to be sexual, it puts pressure on the sexually withdrawing partner. And when there's pressure on them, then they have no space to find their own desire. And that is typically what most sexually pursuing partners want, is they want to know what their partner wants. They want to feel desired by their partner. They want their partner to be an active participant. I mean, I don't think I've ever run across a high desire partner who's like, if you just lay there, I'm good. That's great. As long as you just put out, I'm psyched and I'm satisfied. That is just not something that I hear. And a lot of times what happens is when couples come to see me, they've been in this obligation cycle for a period of time. And it may be that the sexually pursuing partner didn't notice right away that this was what's happening. But over time, they start to be like, I don't even want this anymore. Like, that's not what either one of them wants. And so when we take the pressure off by doing this sort of no sex solution as we are actively working on it, the idea is that the sexually withdrawing partner can start to come forward and ask for what they want. And that may look very different. And so a lot of times the sexually withdrawing partner may be so shut down, they may be so overwhelmed, especially if this is in the context of them, that sexually withdrawing partner also being the primary parent or the default parent, is that they may really need to figure out what they want outside the bedroom. So what they want, maybe what they fantasize, may truly be like a weekend in a hotel room by themselves. And okay, that is a very strong desire. So we celebrate any sort of desire because desire begets desire. And it doesn't necessarily have to be sexual, but the more we are able to have space for whatever desire emerges to be valued and valuable, then that also wakes up other sorts of desires as well.
Mm-hmm. I feel like we've only scratched the surface, but we are out of time. Definitely pick up the book. It's called Parents in Love: A Guide to Great Sex After Kids. I really enjoyed it. The anecdotes, which were or the hypothetical couples that you include that are basically amalgamations of couples that you've worked with, I thought were very relatable. It's a very practical read. I highly, highly recommend it. Thank you so much again for joining me today, Rebecca Eudy.
Thank you so much for having me.
For more on Rebecca, visit RebeccaEudy.com. That's RebeccaEudy.com. You can also check out her sexual health podcast, Under the Hood, at underthehoodpod.com, or pick up a copy of Parents in Love: A Guide to Great Sex After Kids, wherever books are sold. If you enjoy this podcast, please share an episode with 2 of your friends. Head over to patreon.com/whydowedo-that-podcast to become a paid supporter of the show. You'll gain early access to episodes as well as bonus video content. Follow on Instagram or Facebook at Why Do We Do That Podcast, or on X at WDWDTpod. Until next time, this is Dr. Ryan Moyer, hoping you found some answers to the question, why do we do that?